Everyone, welcome to Healing ALS Expert Talks. This is kind of a transition from our community meetings that we've always had. And just to let you know that we are coming to you out of love, care, and concern for everyone. It is important that you understand that we are a healing ministry because we want to be able to reach out, touch, and help all of those, not just physically, but mentally and spiritually, which is really important for the whole body to heal. Today, we have a wonderful speaker, Dr. Lee Cowden. Tish is going to introduce Dr. Lee Cowden. I just want to let you know that it's been an honor and a privilege for me to be able to work with him over the amount of years that we have worked with each other, and what he is doing for mankind is absolutely incredible. Tish, can you go ahead and introduce Dr. Cowden and let us know that we are talking about concussions, neck injuries, scarring, surgeries, everything that affects ALS? Go right ahead.
Okay, so before I introduce Dr. Cowden, just to remind everyone that at this gathering, we welcome believers who are coming together to heal the mind, body, and spirit. We are a nonprofit, non-denominational healing ministry. We believe in physical healing with guidance of a higher power using conventional and integrative medicine. Um, and just we gather together and ask for spiritual guidance that this session will give inspiration, ideas, and information that will assist everyone in their healing journey.
Amen.
As part of our ministry, we offer education, and this is not to be interpreted as medical advice. Those with ALS who go through the 47 Steps Healing Education Program have an 85% response rate to slowing progression of ALS, with 40% stopping or reversing ALS progression. So we welcome Dr. Lee Cowden. He is our director of our medical team, and we so appreciate this. Our medical team is volunteers a lot of time to advise us and just to look and search for answers for ALS. And today's topic, which is specifically on the
Concussions, neck injuries, scars, surgeries, all of that, which does affect ALS.
Absolutely. It's a very important topic. And what the best part about today's topic is Dr. Cowden is going to actually talk about what you can do about it. Because some people are saying, oh, there's not that much you can do about it. It happened 20 years ago, 10 years ago, 5 years ago. But there is a lot you can do about it. So Dr. Cowden has approximately 50 years of experience, expertise, with functional medicine and integrative medicine. So he went to conventional medical school, but since he graduated from medical school, he has basically been working on integrative medicine. So looking at both conventional and functional medicine. And we so appreciate all of the experience that Dr. Cowden has. He is the scientific advisor for ACIM, which is the American College of Integrative Medicine. He teaches doctors from all over the world, has been doing that for at least the last 30 years. And we're just so pleased to have him speaking today. So Dr. Cowden, you are officially on.
This is an area of contribution to ALS that gets unfortunately ignored for the most part by allopathic medical doctors. So that's why I think it's so important for people that are listening to understand what we're talking about. But previous head injuries, neck injuries, scars, surgeries can all affect ALS. And I'm going to talk about each one of those as individual topics within this. There's my bio, and the most important is the three websites at the bottom, the drleecowden.com. On there, everything is free. On healingals.org, much of the information is free. And the ACIM Connect, that's the Academy of Comprehensive Integrative Medicine that I co-founded in 2008, and it has over 1,000 hours worth of integrative medicine education, but most of that requires a fee. Okay, so what I will discuss in this presentation, evaluating and treating concussions and traumatic brain injury, evaluating for and treating cranial suture restrictions and scars elsewhere, the value of exercise with oxygen therapy plus infrared light emitting diode treatment or pulse electromagnetic field therapy for traumatic brain injuries, evaluating for and treating spinal injuries, especially cervical, and how that's important for ALS. And then the surgeries that everyone should try to avoid. And then finally, how to reduce inflammatory response and free radicals. So first on traumatic brain injury, there's 5.3 million Americans living with traumatic brain injury disabilities and associated brain inflammation. That's a bunch of people. Uh, and it's a higher percentage in patients with ALS than it is in the general population. If a person, this is research that shows that if a person uh, uh, had an onset of ALS before the age of 60, that increased by 24% if they had a TBI, before age 60, but by 58% if they had 4 traumatic brain injuries, and by 103% if any traumatic brain injury were before age 18. Okay, so we're not talking about just a little increase incidence of ALS, but a significant increase of ALS if you have traumatic brain injuries and concussion. By the way, a lot of people have traumatic brain injury, but they don't get knocked unconscious, so then they don't have a clear definition of concussion, and so the allopathic medical community kind of ignores those that have had a severe blunt blow to the head. Um, but those people do have inflammation in their brain and contribution of the inflammation to the ALS. The traumatic brain injury often disrupts the blood-brain barrier, and that's a problem because the blood-brain barrier is supposed to keep toxins out of the brain. But if the blood-brain barrier is disrupted, then toxins can flood into the brain and create trouble in the brain. A large percentage of ALS patients have had a TBI sometime in their life. If you ask the patient, if they've had a traumatic brain injury, most of them will say no. But if you say, when did you have a blunt blow to your head? Most of the people can remember an event or have been told about an event in their childhood that the parents told them about. But the effects of the traumatic brain injury can persist for decades after the event. I treated one man who had a traumatic brain injury more than 30 years prior to developing rapidly progressive dementia. And that was from one traumatic brain injury that did not cause a loss of consciousness more than 30 years prior. But anyway, the traumatic brain injury can contribute to dementias and ALS and other neurodegenerative diseases. When uh, when you're asking though, make sure you say, when did you have a blunt blow to your head, not have you had? Okay, because you get different answers. The traumatic brain injury effects on neural health can be correlated, can be corrected decades after the event. So that fellow that had the dementia onset 30 years, from an event 30 years prior, we were able to reverse his dementia by about 70% in 10 days. So, you can get pretty rapid improvement if you know what you're doing and know what you're looking for and know how to fix it. I'll talk about that a little bit later. Also, injury to the skull oftentimes is associated with injury to the neck, and that can occur, either one of those can occur during vaginal delivery, especially if forceps are applied to the baby's skull to get the baby out of the vaginal canal. Okay, so the first step is to determine which parts of the brain are affected. We can do that with, nuclear SPECT brain scanning or functional MRI scanning, but those are expensive procedures. If your insurance doesn't cover it, you you probably need to just find a skilled osteopath or skilled chiropractor who knows muscle testing well, and identify where the brain injury occurred by muscle testing. And I find that that correlates extremely well with the SPECT brain scanning and the MRI scanning. Okay, so if you're in an automobile and you have a sudden stop and you don't have your seatbelt on or on well enough, your head flies forward and hits the windshield, and so you get a traumatic brain injury on the frontal part of your skull, the frontal part of your brain. But what happens is your head whips back after that, and the brain pounds against the back part of the skull and creates a traumatic brain injury on the back part of the brain. That's called a contre-coup injury of the brain. But you usually also damage the neck in a whiplash type injury like this. So these are some of the things that happen when you get that traumatic brain injury. You don't damage just the skull, you damage the bone marrow inside the skull, you damage the blood vessels that go from the bone marrow into the brain, and there's cytokines, chemical messengers of inflammation, and neutrophils, white blood cells, macrophages, other white blood cells, monocytes, and B cells, all going from the bone marrow into the brain at that point of brain injury. Now, this is something that uh, gets ignored, unfortunately, even by a large part of the integrated medical community. But when you have a blunt blow to the head, white blood cells migrate into the scalp where the blunt blow occurred, and the white blood cells release cytokines, and the cytokines uh, attract fibroblasts, and a fibroblast produce fibrin, and the fibrin gets down in these little squiggly sutures that are in the skull. The coronal suture that you can see there, the lambdoid suture in the back. And when the fibrin gets into those sutures, it causes those sutures to get welded together. So the bony plates of the skull no longer move at all in relationship to each other, but they're welded together. So if you're pressing on a person's skull that has never had a traumatic brain injury or a contusive injury to their skull, it feels like a soccer ball. It gives when you press on it. But if that person has had a traumatic brain injury and you press on their skull, it feels like a bowling ball. There's no give at all. And so it's really important to fix these welded sutures so that they're freed up and the bony plates can move in relationship to each other, because every time you breathe in and breathe out, the bony plates move in and out in relationship to each other. That causes a pumping action inside the brain that pumps the toxic cerebrospinal fluid through the pathways that it's supposed to go, and also causes the pumping of the lymphatic fluid, called the glymphatic fluid in the brain, to be pumped out of the brain so that the brain can detoxify. So if there's no movement of the skull when you breathe in and out, then there's no pumping action to get the toxins out of the brain. Okay, so that's what I just described there. Uh, that welding of the bony plates together at the suture lines, and you lose that pumping action that you need to detoxify your brain. Most patients with neurodegenerative disease or chronic headaches have had a previous contusive injury. So as I said, if you can't afford a MRI scan or a PET scan, sorry, a SPECT scan of the brain, then at least do muscle testing to find out where the brain is injured and where the skull has been injured. If you put your fingers on the sutures, that should not cause a weakening by muscle testing. But if you put your fingers on the sutures and the muscle weakens, then you know that that suture is welded together and it needs to be broken up. So you can do that with forceful manipulation of the skull bones. Uh, push down on one side of a suture and watch the bone pop up on the opposite side, and then push down on the side that popped up and watch the other side pop up. And so once bony plates are moving up and down in relationship to each other. They'll move in and out in relationship to each other. You can also use a massager gun, which I'll show you in a subsequent slide here. But the massager gun does the same thing that your hands will do, but it does it faster and easier. Here's a massager gun, picture off the internet. And of all those heads that come with it, there's only one that's acceptable to be used on the skull. That's the one on the bottom row, you know, just to the left of the far right one. And I blew it up there so that you can see it closer up. But inside that head is air. And so when you put that on the massager gun and the massager gun moves in and out about half an inch or a centimeter, uh, all of that movement is not exerted on the skull, but because there's air inside the head, a lot of the in and out movement is cushioned by the head, and so you're uh, putting a force vector down into the skull to break up the suture, but not causing a severe rattling of the brain. Okay, so unfortunately, most of the massager guns that were on the Amazon used to have soft heads like this. They were orange head with that shape, but now it's really, really difficult to find a massager gun that comes with the correct air-filled orange head. But you can buy a set of heads off of Amazon that have the correct head in it, and then put those on your massager gun that you buy from a different uh, web page. When you're doing the massager gun treatment, you don't put the gun, you don't point the gun straight into the skull. You point it in at a 45-degree angle. So that 45-degree angle helps to break up the scar better than if you put it straight in. You're going zigzagging back and forth across that suture with the massager gun. And the zigzagging then helps the uh, suture to break free so that the bony plates will move in relationship to each other. Okay, so as I said, your skull should be like a soccer ball. When you press on it, should have some give, but if it's more like a bowling ball, that means you have had a contusive head injury, even if you don't remember it. And you can actually push on your own skull if you have strength in your hands to do that, and figure out whether you have a previous concussive head injury, contusive injury of the skull, at least. Okay. It's in my experience, it's very difficult, if not impossible, to reverse a traumatic brain injury of the brain if the skull is still jammed. So the first step is always to unjam the skull so the skull bones will move in relationship to each other and pump the toxic cerebrospinal fluid, toxic lymph fluid out of the brain. If a patient has had a fist punched into their nose, which a lot of people do, a lot of men do, then that can cause a scarring in the sutures in the sphenoid bone deep in the skull, back behind the eye sockets. And that, in my experience, that requires the massager gun to break that up. You can't do that sufficiently with your hands, or at least I can't. So if a patient had a blunt blow to their head and their skull bones got jammed and that caused misalignment possibly of the neck as well, and they went to a dentist after that, and the dentist did some dental work on them and adjusted their bite to the malalignment of their skull or their neck, then because the bite takes precedence over all other joints in the body, even if you fix the skull jamming and the neck misalignment, uh, the skull bones will migrate back into a jammed position, and the neck vertebra will go back into a misaligned position as a result of the patient biting down on that maloccluded area of their jaw. So you got to get all the skull bones adjusted and all the neck bones adjusted before they go to the dentist office. You put some cotton gauze rolled up between the molars and the back on both sides and send them to the dental office from the office where the bones of the skull and neck are adjusted. And then the dentist adjusts the bite to the correct alignment of the neck and the back and the skull uh, so that the adjustment of the bite then maintains the adjustment of the other bones. Okay, traumatic brain injuries can have negative effects decades after the head injury, as I mentioned before. And what I find is that there's usually energetic evidence of a small area, sometimes the size of a dime or a quarter, in the center of a contused area of brain. But around that is a larger area, which is called the stunned area of the brain. It's not dead, but there's a peri-infarction ischemic zone around that area of brain in the center that's dead. Well, the goal in working with traumatic brain injury is to resuscitate those stunned brain cells, the cells in the peri-infarction ischemic zone. And we can do that very efficiently with EWAT and to a little bit lesser efficiency with hyperbaric oxygen. But anyway, you can verify after you get all that work done with a follow-up functional MRI scan or PET scan or SPECT scan to prove that the problem that was there is no longer there. Or you can have a skilled muscle tester retest the area and verify by muscle testing that it's okay. Anyway, we use either a small pulsed electromagnetic field coil over the brain where there's the stunned area, or we use a 48 infrared LED light, which you can buy off of Amazon for $20, while we're doing exercise with oxygen therapy. Now, I'll show you that on a subsequent slide so you can understand better what I'm talking about. But the exercise with oxygen therapy has to be done the right way. So it's a procedure that practitioners can learn and apply. Okay, chronic inflammation in and around the traumatic brain injury can improve with EWAT plus infrared therapy or pulse electromagnetic field therapy. It might require several sessions. In my experience, it usually requires about 10 sessions for a moderately severe contusive head injury. It might take 15 sessions or even 20 for a really severe contusive head injury. If a patient with ALS can pedal a bike, then you can do the EWAT therapy while they're sitting on the bike pedaling with the correct equipment that I'll show you on a subsequent slide here. But if they can't pedal a bike, then you can always put them in a hyperbaric chamber and do the pulse electromagnetic field therapy while they're in the chamber or immediately after they come out of the chamber. Okay, so here is the apparatus to do the EWAT therapy. On the far right is a bag that has two different chambers. The upper chamber holds 95% oxygen, and the lower small chamber in the bottom right corner of that big white chamber is a chamber that contains 15% oxygen. So the oxygen concentrator down there below the bag will produce, high concentration of oxygen to go in the big chamber, or low concentration of oxygen to go in the bottom chamber. And so once you get your chambers, your bag filled up with the right concentration of oxygen, then you connect that with a tube to a mask that the patient has on that's sitting there on the bicycle. And there's a lever on that tubing that allows you to switch quickly from the 95% oxygen to the 15% oxygen. And so the patient typically will do some warm-up exercise with the bike to get the system going while you're on 95% oxygen. And then you have the patient speed up their pedaling and turn on the 15% oxygen, turn off the 95% oxygen. And you do that hard and fast for a few seconds until the oximeter, the finger oximeter that's in the bottom right corner on the finger, shows that the saturation has dropped low enough to get a lactic acid production inside the brain. The lactic acid in the brain will dilate the blood vessels, and when you turn the patient back on to 95% oxygen, it'll flood that wounded part of the brain with oxygen, and that resuscitates those brain cells that have been injured for sometimes decades. Oh, while you're doing all of this, you put the little coils from the electromagnetic device in the top left corner over the area of contusive head injury based on MRI or SPECT scan or muscle testing. And the purpose of the coils is to deliver some alpha waves into that part of the brain to stimulate those cells that are sleeping to wake up. Now, if you that device that electromagnetic device in the top left corner is about $650. And if you can't afford that, you can use the $20 light in the bottom left corner over that same area. And you just got to make sure you do that in a dark room, because the little photo sensor in the middle of the light will turn all the infrared lights off if you do it in a room that has too much light. But with not terribly expensive equipment, you can actually resuscitate the brain. Again, about a 30-minute session daily for at least 5 days, if not 10 or 15 days. Now, for a patient that's paralyzed and can't pedal a bicycle, you put them into the infrared or into the hyperbaric chamber with a little infrared flashlight shining on the place on the brain that needs to get the extra blood flow. Now, this chamber is big enough for a patient in a wheelchair to be rolled in and a helper to go in the chamber with them to hold the light in the right place. So it's all doable.
Red. Where's my red?
Yeah, so this is an infrared flashlight, not just any old flashlight, but it has to be 850 nanometer wavelength flashlight. Okay, and then after they come out of the chamber, you put a headset on them and you retrain their brain. So this headset pulses one frequency into one ear and another frequency close to that in the other ear. And the difference between the two frequencies is what the brain calls the treatment frequency. So if you have 108 hertz going into one ear and 100 hertz going in the other ear, you get a net frequency of 8 hertz. And so the glasses are flashing at 8 hertz also. And you can put on a variety of different colors. You can muscle test to figure out what the best color is for the lights that are on the eyes while you're pulsing the sound into the ears. But this retrains the brain. It rewires the circuits, basically. Okay, so now we're going to transition over into neck injuries. Um, this is information that I ran across fairly recently, but in this research, they compared cervical and the thoracic and lumbar MRIs in 52 ALS patients and 48 patients with Parkinson's and 28 patients with chronic inflammatory demyelinating polyneuropathy, CIDP. So what they found is that the ALS patients had a narrowing of their cervical spine, cervical cord. Oh, I'll get this right in a minute. Had a narrowing of the cervical spinal canal. There, we finally got it. That was pressing on the cervical spinal cord in 38% of the patients, at least 38% of the patients. It was causing compression on, they said, some degree of compression on 53% of the patients. And that was not found in the patients with Parkinson's or the CIDP. So this is a a meta-analysis that showed the same thing that you can look up on the internet. So it's logical that ALS patients would be more susceptible to a whiplash injury because when you have a whiplash injury, oftentimes there's what's called a herniation of the nucleus pulposa. That's what they call a bulging disc in the cervical spine that presses against the spinal cord in the cervical spine. Since the spinal cord since the spinal canal is already narrowed in patients with ALS, then they're much more susceptible to a whiplash injury than the average population. Each year, there's about 4 million injuries in the United States from auto wrecks, and many of those are associated with whiplash injuries. So whiplash is the most common injury in motor vehicle accidents, affecting 83% of patients involved in collisions. Okay, so of the 4 million injuries, 83% of those involve whiplash. That's a lot of people. Now, by the way, you can get a whiplash injury without having an auto wreck. You can fall off a ladder. You can fall down some stairs. You can have other types of traumatic injuries that cause a whiplash effect. Okay, so how do we treat this? I don't like to give somebody a problem unless I have a solution. So skilled osteopaths or certain chiropractors can find and correct the structural misalignments of the spine and the scars of the body's fascia. That's the connective tissue where the injury occurred. Uh, and that's especially important to do for the cervical spine. Now, patients that have limb onset ALS very, very, very often have a contribution to that from their cervical spine that gets ignored for the most part by allopathic medicine. What you should be doing is you should be doing a functional MRI scan of your cervical spine if you had limb onset ALS, because if you don't look, you don't know. WNL does not mean we never looked. It means within normal limits. So you need to do the test before you know that it's within normal limits. But anyway, the massager gun at a 45-degree angle to the skin can break up the fascial scars in the neck, which then oftentimes improves the structure of the neck enough to where the pressure on the cord is reduced in the cervical spine, and then the patient has an improvement in their condition just by using the massager gun on their neck. You can also treat scars to improve the acupuncture meridian flow through the scars. In the neck, in the posterior neck, there are acupuncture meridians for the uh, urinary bladder, the governor vessel, and the gallbladder meridian. And so scars in those meridians will affect those organ systems, the urinary bladder and the gallbladder, but also the governor vessel uh, has affects many different acupuncture organ systems. So, the deep scars are best treated with massager gun. The shallow scars are best treated with clay mud. So I'm going to describe how you do the clay mud treatment. You mix 4 parts of each of the following 4 herbs into a glass. That's Nutramax berber, banderol, ticuna, and algus, and 1 part of each. And then 4 parts of water added to that. And then you add to that the, the calcium bentonite clay powder until you get a consistency of mud that's the right consistency to apply to the area where you want to apply to a shallow scar. A visible scar is treated with a clay mud. And you can treat safely about 6 inches of scar per day. So if you've got more than 6 inches of scar total on your body, probably need to do it in more than 1 day. But anyway, you apply the mud for 10 minutes and then wipe it off or wash it off, and then apply fresh mud to the same scar for another 10 minutes and then wipe it off or wash it off. And then you apply mud a third time to the scar for 10 minutes and then wipe it off or wash it off. And oftentimes, those 3 applications is enough to fix the energy flow through the scar, through the acupuncture meridian that runs through that scar permanently. Occasionally, it requires a second treatment, but muscle testing will tell you whether you need to do a second day of treatment at some point after that. Anyway, you treat all the scars because, again, most of the scars that are on the body are running across an acupuncture meridian, disrupting energy flow through the acupuncture meridian, and therefore the energy in the organ that's attached to that acupuncture meridian is being disrupted. And so that's not a good thing. Now, for keloid scars, sometimes you have to do procaine, preservative-free procaine injection into the scar. You take a 1.5-inch long 27 gauge needle and with procaine in the syringe, and you run that needle through the full length of the scar and then inject procaine as you pull the needle back out of the scar. And that causes the scar to wheel up a little bit. But that oftentimes is enough to break up the energy flow through the scar. I always use clay mud application on the scar after that because I found that if you don't, oftentimes the trauma from injecting the scar will cause toxins to reaccumulate in the scar and the scar to become blocked again. But if you do the clay mud application, usually that doesn't happen. It's best not to get tattoos or body piercings because they disrupt the acupuncture meridian flow. If you already have tattoos or body piercings, then there's a few things that you might be able to do to help that. But if you have body piercings and you're willing to get rid of those body piercings, then you just stop putting the metal in the piercing place, and the area oftentimes will heal up over time, and you can use the clay mud application to finish the healing process. But the other problem with tattoos is that the coloring that is in the tattoos usually is caused by toxic heavy metals in that tattooing process. So they're depositing toxic heavy metals into the skin with the tattooing process. And sometimes those scars need to be uh, treated with laser or treated with surgery because they continue to poison the body enough to uh, not have good ability to recover from a chronic illness. Okay, some evidence that cervical injuries predispose to ALS. When you get a cervical injury, you get a disruption of the spinal cord blood barrier intersection. And that causes toxins to flood into the spinal cord at the cervical level. Okay. And so it's just like the disruption of the blood-brain barrier, you can get a disruption of the spinal cord blood barrier. But anyway, the research shows that's probably contributing to ALS in patients that have had a cervical injury. Okay, but the loss of the barrier integrity permits extravasation of plasma proteins, white blood cells, and protein activation, protease activation, as well as edema, demyelination, and neuronal death. So that's pretty condemning of the effect of neck injuries on ALS. The pericytes play a key role in maintaining blood CNS barrier. So the damage that's occurred in the blood-brain barrier, the blood spinal cord barrier, is correctable in ALS patients. Uh, you know, with light therapy, we can put a vial of the homeopathic substance that's represented, the toxin that's represented in the body by energetic testing. We can put that in front of infrared light that I showed you earlier for the treating the brain, and we can shine that light into the cervical spine and drive that toxin out of the cervical spine using photonic therapy, light therapy. 11 of 11 cervical cords from ALS patients, but none of the patients with other non-neurodegenerative disease controls had perivascular deposits in the erythrocyte-derived hemoglobin. When you get a cervical injury, one of the things that happens is blood vessels break and red blood cells leak into the tissue. When red blood cells leak into the tissue, the red blood cells are gradually broken down by white cells and by enzymatic action inside the tissues, and that releases hemoglobin into the tissues. The hemoglobin has in it iron, and iron is a free radical that damages the tissues. So that's the primary way that a person that gets a stroke gets damage to their brain is the hemoglobin is released from the red blood cells in the brain, and the iron in the hemoglobin is a free radical that damages the brain tissue. There's a 3.1-fold increase in perivascular hemoglobin in ALS patients compared to controls. Not a little bit more, but 3 times more. There was also a 54% reduction in pericytes in ALS patients compared to controls in that research study. The pericytes are what's going to try to clean up the debris. Okay, so how do you reduce the brain and spinal cord inflammation? You reduce the MF as much as possible. That's the voltage-gated calcium channels are flooding calcium into the cell and causing free radical damage inside the cell. So you don't want to have that going on. You want to stop the use of cordless phones and cell phones up to the head. Always use your cell phone on speakerphone mode at arm's length and shout at it. And get rid of the radio frequency burglar alarm system in your house. Make sure that your Wi-Fi is turned off all the time if possible, but at least all night long, if not possible to turn it off all day long. And and make sure you're charging your cell phone at least 30 feet away from your bed, preferably in airplane mode with the Bluetooth and Wi-Fi on the cell phone turned off. If you plug in the appropriate Blue Shield device for the place that you live, then that helps to reduce the harmful effect of the electropollution in your environment from your neighbors on your body. You can't usually convince your neighbors that they need to turn off their Wi-Fi and their radio frequency burglar alarm system and their cordless phones and all that stuff at your bedtime. So you're getting zapped by their stuff 24 hours a day. If you live in a city or a town, especially in an apartment complex. You need to take plenty of highly absorbable magnesium because the magnesium is the main thing that prevents the flooding of calcium into the cell, which then prevents a lot of the free radical damage going on inside the cells. You also need to take liposomal curcumin to act as a anti-inflammatory in the brain and the spinal cord, because if you have had a head injury or neck injury, you'll have inflammation in that place in the body. And you need to take 25 drops of Nutramax Dandelion to try to get out of the body the spike protein, spike RNA, and spike DNA that's come into your body from being shed upon by people that are still taking the COVID injection. And by the way, people continue to shed the COVID for, we know, up to a year after the COVID injection that they took. So they're continuing to shed upon you all that time. You need to rub 30% DMSO on the posterior neck and back each evening. That's helpful in getting some of the toxins out of the spinal canal and out of the brain, because the DMSO that you rub on the back, some of it actually goes up into the brain. I don't use higher concentration than 30% because you can burn the skin with higher concentrations. So 30% works pretty well and is well tolerated. It's ideal to get 15 to 20 minutes of sunlight exposure during the day between 10 a.m. and 1 p.m. and also ground to the earth at the same time if you can. And then be asleep by 9 p.m. each night if you want your organ systems to detoxify and regenerate. The endocrine system, then the then the gallbladder, and then the liver, then the lungs, all detoxify between 9 p.m. and 5 a.m. So that's the ideal time to be asleep in a pitch black bedroom with no significant chemical toxins in the air or any light coming in. Okay. Need to avoid trans fats, fried foods, sugars. Uh, use Nutramax stevia or nail brand monk fruit as a sweetener if you want to have some sweetening. And then eat more sardines, squid, scallops, wild-caught shrimp to increase your DHA, because that's important to reform the cell membranes and the organellar membranes inside your brain and spinal cord. This is the minimally invasive procedures for cervical disc herniations. If you've had a whiplash injury and you have a disc pressing on the cervical spine, you could go through a major surgery where they use an incision and open up the neck and uh, go in there and remove the disc that's pressing against the cord. But that's a major deal, and quite a bit of recovery time, usually 6 weeks to 12 weeks recovery time. But you can also do uh, treatment with uh, less invasive means. So the minimally invasive procedures uh, that are considered are percutaneous laser disc decompression, and you put a little skinny catheter in the lower spine and thread it up inside the spinal canal till you reach the area of obstruction, the cervical canal, and that little catheter has in it a fiber optic bundle that will deliver laser light into the disc that is pressing on the cord in the cervical spine level, and that whole process can be guided by ultrasound to the point where you think you're ready to do the laser treatment. Then you do a quick fluoroscopic X-ray picture to verify that you're in the right place, and then you do deliver the laser into the disc through the fiber optic bundle, and that'll disintegrate the enough of the disc that's pressing against the cord so that the cord is no longer compressed. There's also another procedure where you put a a, 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 a needle, basically, that has electrodes on it into the area where the disc is pressing against the cord, and you deliver electricity through that needle, basically fry a portion of the disc so that it retracts away from the cord. And then there's another technology called the PDCT, uh, but that's a radio frequency electrode. Uh, they uh, those are technologies that were developed in Korea and not used very much in the United States. But you can go to Turkey and get that kind of procedure done. There may be some place in the United States where you can get it done. Okay, a little bit about surgeries and trying to avoid those. The most common surgery that adversely affects ALS patients is removal of wisdom teeth incorrectly, and 99+% of all the wisdom teeth that are extracted in the United States are done incorrectly. And because of that, when they used a very small ultrasound device analyzing the jawbone of military recruits at the military base in Colorado Springs, they found that if the military recruit had had all 4 wisdom teeth removed the standard way, that they had a 100% probability of having a chronic infection in at least one of those 4 wisdom teeth sockets. Some of them had 2 wisdom teeth sockets affected, some of them 3, some of them even 4. But interestingly, less than 1% of all those recruits had any symptoms in their mouth at all. But the the uh, the wisdom the acupuncture meridians for the heart and the small intestine run through the wisdom tooth socket. But if the wisdom teeth sockets are not, or if the wisdom teeth are not removed correctly, not only does the wisdom tooth socket become infected, but the area right behind the wisdom tooth socket which is called the retromolar area, also becomes affected, and the retromolar area affects uh, I think it's 10 of the acupuncture meridians. The meridians for the nervous system, the lymphatic system, the circulatory system, the hormonal system, and several others. So it's really important to, if you've had wisdom teeth extractions, to do some type of evaluation to figure out whether there's chronic infection in your wisdom teeth sockets and the retromolar area behind that, and correct and do treatment to correct that if you can, because in my experience, sometimes that's the last thing that has not been addressed in a patient. The first patient that I ever treated with ALS that reversed had that going on, and when we did everything else, still had the problem. So he went and got that done by the dentist, and after that, he was able to get out of the wheelchair and start jogging. So it's a very important issue. Dental implants and root canals in the teeth often also cause chronic osteitis in the bone and chronic uh, trouble in the nervous system. And so, if you have root canals, you need to have those evaluated. If you have dental implants, you need to have those evaluated. And those that are causing significant problems for the physical health need to be probably removed. Haven't found another way to deal with that. But if you do remove a root canal, tooth, or a dental implant, you need to clean out the socket extremely thoroughly so that there's not any residual infection continuing to poison the nervous system. Appendectomy needs to be avoided if possible. Oftentimes, if you go in for an abdominal surgery and you don't handwrite on the operative permit, I do not agree to have my appendix removed, then it will be removed because surgeons get a little more money when they take the appendix out also, and they think it's a superfluous organ, but it's not. You know, the when a person takes oral antibiotics, uh, if they don't have an appendix, they don't have friendly bacteria to be able to repopulate their bowel. If you have an appendix still, you have friendly bacteria down in the bottom of that appendix that can repopulate the bowel with friendly bacteria. And so, antibiotics aren't nearly as harmful to people that have an appendix still. But if you don't have an appendix, bad idea to take oral antibiotics. You need to try to find other ways to treat the infection if you can. Okay, cholecystectomy. A lot of surgeons believe that the gallbladder is a unnecessary organ, but that's not really true, because if you don't have enough bile salts dumped by your gallbladder into your bowel, you can't absorb vitamin A, D, E, K, EPA, DHA, and other fats that are essential for health. So it's important to try to keep your gallbladder if you have it. And so on the same operative permit for abdominal surgery, say, I do not agree to have elective cholecystectomy. Okay, if you have had your gallbladder removed, you need to take ox bile tablets or TUDCA with every fatty meal and all your fat-soluble nutrients in order to be able to absorb those sufficiently. Joint replacements need to be avoided if at all possible. In my experience, most joint replacements are done on the knees in patients that could have had their knee problem resolved by injecting either ozone or ozonated glycerin into the knee joint, and you know clear up the infection that's in there, and that causes the inflammation to settle down, that causes the pain to go away, and that causes the patient to realize they don't really need a knee replacement. You also usually take oral herbs to work on the infection from the bloodstream side. If you can avoid coronary stent placement, that would be advisable. The coronary stent that's left behind is a foreign body in the body. Every time you brush your teeth or floss your teeth or have a bowel movement, you seed your bloodstream with bacteria and fungi, and they float around through the bloodstream looking for a nice place to live. The place that they prefer to live is a foreign body. That could be a synthetic knee joint, or it could be a coronary stent, or it could be a mesh in the abdominal wall where they've repaired a hernia. But the microbes are looking for a nice place to live, and they prefer to live where there's a shelter. And so the artificial stuff that surgeons put into the body become that shelter. Okay, if you can avoid prostate needle biopsy that or breast lump biopsy, that would be recommended, because there's research that goes back 25 years that shows that doing so seeds those cancer cells into the lymphatic system, into the venous system, and increases the probability of getting metastasis. So you can determine whether a prostate lump is a cancer or not with an ultrasound Doppler of the prostate. And so that's a non-invasive way to figure out whether it's cancerous or not. And you can do the same thing on the breast. You can do an ultrasound Doppler duplex imaging of the breast lump and determine with high probability whether it's cancer or not. Alternatively, if you can't get somebody to do an ultrasound Doppler duplex imaging of the breast or the prostate, you can do a functional MRI scan. Usually you can find an integrative doctor who's willing to order a functional MRI scan of the prostate or the breast. It's not typically done for that. It's usually done only for brain and spinal cord stuff, but it is possible to do it. And then if you can avoid a lumbar discectomy, that would be recommended. I've found that a high percentage of people that have a pain from a lumbar disc actually have accumulation of mercury in their thoracic spinal cord that's affecting their blood flow to and their nerve flow to their lumbar spine. And when you get the mercury out of the thoracic spine with either German neural therapy or even photonic therapy, then oftentimes you can avoid the lumbar disc surgery. Okay, so we finally got to the end there. I'm going to stop sharing.
Okay, thank you so much, Dr. Cowden, for that. This is complex, guys, so feel free. This is recorded. We will be putting it up in the past events. So, and it will be on YouTube, and the question and answer will also, there'll be links to both the question and answer and the presentation. So please feel free to, check healingals.org past events to find this and the Q&A. Thank you very much, everyone, for taking your health into your own hands and for staying on. This has been a long meeting, so a lot of details, and thank you so much, Dr. Cowden.
Thank you so much. And bye-bye, everyone. Thank you for being here. Bye-bye, Jalal. Bye-bye, Rosa, Adolph, Alan. Thank you for coming there. Thank you for being here. Carl, thanks for being here. And Jonathan and Claire, thank you for being here. And Lisa, Dr. Calderwood,